The Maui wildfires have left deep scars in our communities, impacting the environment as well as our health and well-being. The Maui Wildfire Exposure Study, or MauiWES, is a partnership between the University of Hawaiʻi and various community organizations, including Maui Medic Healers and Roots Reborn, and funders such as the Maui Strong Fund from the Hawaii Community Foundation. We seek to understand the long-term social, behavioral, and health impacts of the wildfires.
Today we're here in Royal Lahaina to recruit participants in a new research study, and what we're doing is collecting participant information about those who've been impacted by the wildfires and the aftermaths, and collecting samples from them, including biospecimens such as urine, blood, saliva, as well as information in a questionnaire form to understand about some of the impacts that they've experienced over the course of the recovery.
So, we really like to make sure that the community knows about this study, and we'll come out and do the survey and do the testing, because this is an opportunity for people to have that data for their own health, not in a way that should bring more stress, but in a way that can bring some sort of relief, just knowing that they're okay, or if there's something that's a little bit off, that they can go address it.
Being able to have access to data and information can hopefully help in the future so that we can continue to build more resilience within our communities.
Well, my thoughts on that is that I'm glad that they're doing it, because I remember the Twin Towers, and then like now they all got cancer and they're all dying early and all this kind of stuff, that they didn't do this type of a research beforehand. And so I think that's kind of a playlist of what we should do now to make sure that this didn't affect our citizens of Lahaina.
My spouse and I were actually in the water for 5 hours with 2 dogs the night of the fire. We got trapped on Front Street, and the long-term effects are kind of more of what we're concerned about.
And what we're seeing right now, actually, with participants coming into the study, we've already identified individuals who actually come in with complaints about respiratory conditions, asthma, for example, shortness of breath, skin rashes. We think that some of the hazards that they've encountered during the course of the recovery, they might have been exposed to, and that might contribute to some of those health conditions.
We definitely want to get the word out. This study is trying to be highly inclusive and diverse, make sure it's capturing everybody that lives on Maui.
They're also measuring not just Lahaina, but they're also doing upcountry, and I think that's important to say. We're gonna know about so many things we wouldn't otherwise be able to know, and things that don't show up right away. These are things that show up over a long period of time, and they're tracking things that no one is really tracking right now, and that's mental, emotional health.
It's been very, very difficult mentally, and the stress from everything we went through that night and we're continuing to go through, and the stories that I hear from my students and all of that stuff has mentally been difficult. So I'm curious to see how it's impacted my physical health.
I used to weigh 168 pounds. I just weighed myself, I weigh 153. Because during these months, the diet's been hard to get food, and I've been eating junk food because, just all that's been around. And mentally, it's trying, okay? I'm unhoused, so I sleep in my car, so, it's kind of mentally challenging.
Community trauma needs community healing. And being a part of this study is one way that we can come together collectively. The more we do things like this where we can collaborate and come together, the quicker we can move to a place of mauliola, to wellness and wholeness for ourselves.
I think this could help the community by showing how strong our ohana is and how we all unite and help each other out in these tough times.
So we ask that you share the QRS code or the links to the survey with your friends, your neighbors, anyone that you know that was in the burn zone, a survivor, volunteers, first responders.
We are not just studying the immediate effects, we are looking at the long-term changes in health. You will also receive $100 upon completion of the study and be linked with resources to support you throughout the study. So mahalo for your time and consideration. And for more information and to schedule your appointment, please visit our website, MauiWES.info.